Hi, my name is Bryan Masters. I'm the Vice President of Healthcare for Kent Design Build, and today we're going to show you a project we're working on in Lafayette, Louisiana for Our Lady of Lourdes Health System. We're renovating the 6th floor to create some negative isolation rooms for patient treatment. In each of the rooms off of the main corridor, you have a patient treatment space with a private restroom and shower that we'll get into in just a minute. These main corridors serve as a function for hospital staff, make treatment more efficient. And our goal in building spaces like this is really to make sure that patient care and workflow happens as efficiently as possible and as safely as possible. Right here you're going to see a main corridor tie in to an existing hospital suite. In just a minute we're going to walk out into that existing corridor. You can see how we're tying in our construction to the existing operations of the facility. Prior to construction, this corridor was active. There was storage utilization behind me. And down to my right is actually a burn unit. So you have some intensive care and some very sensitive patients that we want to be aware of. So our superintendent has constructed a hard wall barrier to isolate our space from the adjacent patient space. And at the end of the hallway, you'll see tacky mats. We use covered trash carts and negative air HEPA filtered machines throughout construction to mitigate the risk to those patients that may be more sensitive than those of us working in this room. We have individual exam rooms with private baths and showers, and each of these spaces has a negative air component. So basically what negative air entails is we have more exhaust in a room than supply, and so it creates a negative pressure within that space adjacent to the corridor. Basically it traps all of the particles, the airborne contaminants in that room, and safely exhausts it outside of the facility to minimize the harm and risk associated with those pathogens. So within a patient suite itself, we want to provide a comfortable environment for the patient treatment to take place. And in many cases, they will have family that are either staying or visiting as well. And so integrating the furniture and owner components into these rooms is critical for the success of a project. One of the reasons we enjoy doing projects like this is because we all know someone who has been or is currently in treatment in a healthcare system. And so we each have a personal connection to the end result of this type of project. And so as we construct these rooms, we try to visualize what that final result could be. And as we all know, it's very important to feel safe and secure in that space and feel like you're being treated to the best of the doctor's ability. And so really the space is designed around the patient experience to maximize their treatment at the time of stay. So we're excited to see this project come together. We're very proud to lead the way on innovations like this, to be able to build a project of this nature and ultimately to see it serve the community around us. And so for that reason, we're excited to see it come together summer of 2021.